Okay, so good day everyone. I'm Betty May Hernandez, first year college from BSN 1B. So now I'm going to demonstrate to you the assessing the male genitals and inguinal area with our patient. First, I'm going to introduce myself to my patient and verify his name. So good day sir, I'm Betty, your student nurse for today. May I ask what is your name? Okay, ilang taon na po kayo? Okay. So now we will proceed in explanation. So for the patient to be aware what we're going to do and why it is necessary. So the rationale of this is for the patient awareness in the whole procedure that we will be doing. So good day sir. For today I'm going to assess your private part. Is it okay to you? Okay, for us to know if there are any abnormal findings with that. Okay, so next we need to do the hand hygiene. So the rationale of this is to avoid the spreading of microorganisms or the cross contaminations among patients or clients or vice versa. So next we will provide for client privacy. So the rationale of this is for the patient to be comfortable in the whole procedure that we will be doing. Okay, so for example, close the door or close the curtains. So next we will assemble the equipments that we will be doing. First is the examination gloves. Okay, so after that, we will determine some client history. So sir, naka-experience na po ba kayo ng abdominal pain? Any symptoms po of sexually transmitted disease? Okay. So, any swellings po that could include presence of hernia? Okay. So, any family history of nephritis po? Okay. So, any malignancy of prostate? Malignancy of kidney po? Okay. So, after asking some client history, now we will proceed in the first assessment with our patient. So for the first procedure, for the pubic hair, we will inspect the distributions, amount, and the characteristics of the pubic hair. Okay, so the pubic hair of our patient is coarser than the scalp hair, and it covers the entire groin area of our patient, extending to the medial thighs and up to the abdomen toward the umbilicus. So next for the penis, we will inspect the pineal shaft and the glands pins for lesions, nodules, swelling, and inflammation. Okay, so the skin of the penis is wrinkled and hairless, and it is normally free for rashes, lesions, nodules, swelling, inflammation, and lumps. And then the gland size and shape appearing rounded, and the surface of the gland is normally smooth, free of lesions and redness. So now we will inspect the urethral meatus for swelling, inflammation, and discharge. Okay, so the urinary meatus is slit-like and it is normally found in the center of the glands. Also, it is free of discharge and inflammation. Okay, so for the next procedure, we will now proceed in palpating. Now we will palpate the penis for tenderness, thickening, and nodular. So in here, we will use our thumb and first two fingers. Okay, So, the penis is soft, flaccid, and non-tender. Everything is normal. So now we will proceed for the scrotum. Inspect the scrotum for appearance, general size, and symmetry. Okay, so the shape is oval. So the left side of the scrotal sac is lower than the right side. Its color is slightly darker than the penis of our patient. So now we will proceed in palpating the scrotum to assess status of underlying testes, epididymis, and spermatic, and also palpate both testes simultaneously for comparative purposes. Okay, so the testes are ovoid, approximately 3.5 to 5 centimeters long, 2.5 centimeters wide, and 2.5 centimeters deep, and it is actually bilaterally in size and shape. And they are smooth, firm, rubbery, mobile, and free to nodules, and rather tender to pressure, and the epididymis is non-tender, smooth, softer than the testes. Okay, so for the inguinal area, inspect both areas for bulges while the client is standing if possible. Okay, so let's imagine my patient is standing right now. Okay, so the inguinal areas is free from bulges and everything is normal. So last is palpate the hernias if present. So let's imagine that hernias is present. Okay, so the bulges or bulging are not normally palpatable. There is no enlargement, the tenderness is present, and everything is normal. Okay, so after all the procedure, we will do again the hand hygiene to avoid the spreading of microorganisms or the cross-contaminations among patients or clients or vice versa. Next, we will proceed in the documentation of the informations with the client in the client record. Okay, so that's how I demonstrate to you the assessing the male genitals and inguinal area with our patient.